Again, good morning, good afternoon, good evening, depending on where you are connecting from. This is another learning webinar, an edition of the Mind and Heart webinar series. By way of introduction, my name is Ben Labi. I'm the head of communications at Regent University College of Science and Technology in Accra, Ghana, and I'm honored to serve as the moderator for this day's session. So in case you're wondering what this webinar is all about, what the Mind and Heart series is all about, I'd gladly run through the concept behind the webinar series. So the Mind and Heart series is dedicated to promoting mental health and emotional well-being. And the series brings together leading mental health practitioners, educators, professionals, students, and it offers insights and key learnings in the field of mental health and emotional wellness. The webinar series covers everyday issues related to mental and emotional well-being and is aimed at helping destigmatize conversations around mental health and provide support and resources. So one special feature of the sessions is they are highly interactive. So there's a live question and answer segment, and the opportunity is created for participants to engage with experienced practitioners. So for today's edition, we are honored to have, for the second time, speaker, Dr. Andrea Holzner, who's a neuropsychologist and gerontologist. And for discussion today is the impact of trauma, post-traumatic stress disorder on mental health and well-being. I'll take that again. The impact of trauma, post-traumatic stress disorder on mental health and well-being. Our speaker, Dr. Holzner, will speak for 45 minutes, after which there'll be a 10-minute question and answer session. And we are also privileged to have as the respondent for this webinar, Dr. Evelyn Owusu Roberts, who's a licensed clinical psychologist and a faculty member at the Department of Psychology at Regent. So as a quick reminder to our audience, if you have any questions to ask, you can feel free to drop them in the chat box, or you can wait till after the presentation to ask your question directly, and our speaker will attempt answering all your questions. So that said, I would at this point proceed to introduce our speaker for tonight's webinar. Dr. Andrea Holzner is a gerontologist specializing in aging, neuropsychology, and well-being during the lifespan. As a professor, published researcher, author, and international speaker, she is actively involved in enhancing geriatric patient care, best practices, ethical standards, and human rights. Through experience and academia, she manages to achieve compassionate insight into the major issues relating to grief, aging transitions, intimacy, and end stages of life. Her holistic approach integrates mind, body, and spirit, providing insight for wellness and achieving the highest quality of life. So now, ladies and gentlemen, let us welcome Dr. Holzner.
Thank you, Benjamin. I'm going to take you on tour with me. I think you're a great introducer. Thank you so much. Yes, we're going to be talking regarding the impact of trauma, post-traumatic stress disorder, PTSD specifically, on mental health and well-being. And I'm hopeful that in the next 45 minutes, you'll get a better understanding of PTSD, learn the differences between PTSD and trauma, the psychological, the physiological implications, and how we can practically improve our wellness and our well-being and find ways to manage even if a diagnosis of PTSD has been had. What is post-traumatic stress disorder? So PTSD is a disorder from the Diagnostic and Statistical Manual, DSM, that occurs after a trauma is witnessed or vicariously a trauma is told. It can happen if there's not only exposure to trauma, but a confrontation to yourself or to others. Trauma can occur to yourself or to others, and it can also come in forms of dreams or nightmares that, yes, have been caused an extra exorbitant amount of stress. And we're going to be talking about the different manifestations and the diagnoses of PTSD. Of course, I'm not going to read all this, but I want you to, at your leisure, take a look at this. The Diagnostic and Statistical Manual of Mental Health Disorders is a compilation of various PhDs that have, throughout the years, have developed criteria for disorders. PTSD is just like any of the others, and there's criteria. And there's a difference between trauma experienced immediately and chronic stress causing PTSD. I think the most important from this is that exposure could be actual or imagined. It can be due to a death, an injury, a car crash, repeated abuse, and there's a direct or vicarious experience of the trauma, right? And there's a chronic, it's repeated, it's prolonged for 6 months or longer. And there are symptoms that are associated with it. And we're going to explore this as we continue. They can cause dissociative reactions where we feel like we're not connected to our emotions. There's an affect where we can't allow ourselves to experience and cry or feel. And there's an intense stress or anxiety. There's an alteration, there's a marked difference with your behavior as a result of this traumatic event. There could be irritability, there could be abuse in terms of self-destructive behavior, alcoholism, drug use. There could be hypervigilance where you can't calm your body at all, exaggerated, startled response, etc. So again, read these at your leisure, but make no mistake that PTSD, when it's diagnosed or undiagnosed, impacts a person's life. Post-traumatic stress disorder can, of course, occur with prolonged war or conflict, where there's just chronic trauma, repeated trauma, social events, political events, rape, assault, neglect, abandonment, child abuse, disease, dying, natural disasters. It's a normative response when a trauma occurs to cry or have emotion, or to have it more of a physiological response where you're tense. And that usually subsides as you continue, right, from trauma. But PTSD, as I mentioned, is chronic, and it continues to be pervasive and intrusive in your life. More than 320 million adults globally have been diagnosed with PTSD. Now, one thing I found interesting is that higher income countries have an increased rate of PTSD. Now, I think that's solely just due to circumstance and the fact that lower income countries might not have mental health providers readily available to do the diagnosing, which is changing, right? There are more countries that are now educating and training for the mental health profession. I think the numbers of PTSD are actually quite a bit higher, especially in war and conflict countries, where there's just this chronic bombardment of traumatic events. Not everyone that experiences trauma does it circumstance into PTSD. Um, and depending on the trauma and the PTSD, there could be such a pervasive physiological response that it really impacts, almost um, stymies your well-being, right? Um, we see PTSD manifesting in, of course, nightmares. And also something I didn't put here are something called daymares or daydreams, which it's just this constant reminder and flashbacks of the event and the trauma. It could impact our eating in terms of not having hunger or eating too much. It could impact our body with tension and aches, and we're going to talk about the nervous system and how that manifests. We could have an increased heart rate. Again, we could be stymied. We could have a fight, flight, or freeze mode. We're going to talk more about that. But basically, due to the intensity of PTSD, we could just be on the defensive all the time, like we're ready to fight, right? Verbally or even physically. Flight is when we just can't open up with PTSD. And so we self-sabotage or we push people away. Or freeze, right? You just can't do anything. You can't proceed happily and with well-being in your career or interpersonal relationships, or for your own well-being. And then, of course, drug, alcohol misuse, overuse, and it definitely impacts interpersonal relationships, where you're not able to connect with others. Interestingly, in studies is that PTSD can have triggers, and now triggers are often called emotional responses, with a scent or a noise or a sudden movement, or a mismanaging of body handling, or just viewing someone as being aggressive could send someone with PTSD into the fight, flight, or freeze mode. So what is the difference between PTSD or trauma, right? Trauma, we all, throughout our lives, 100% of the people that are living today will experience some form of trauma in their life. That's just a given, that's just life. You know, we will see death, we will see job loss, we will see attacks or car crashes or conflict or some kind of trauma. We'll also hear from others about their trauma, or we'll hear a story. And now, due to social media and the internet, we hear traumatic events at the rate of like 3 to 6 seconds at a time. If you're scrolling through the internet, every 3 to 6 seconds, you're getting a new traumatic event. Yes, it's interposed with, you know, bear or animal cuteness, and then you have a stressful traumatic event. Our world today is filled with conflict. There's political unrest, there's war, There's socio changes with the influx of internet and social media. There actually is a decline with interpersonal connection. More people today, even considering how connected we are with Zoom and online and such, are feeling isolated. They're feeling lonely, and the numbers are actually are increasing of people feeling so isolated when we're in a time in our society of supposedly being so connected. These are chronic levels of trauma being bombarded right onto us. So sometimes normatively, we see trauma all the time. Yes, it impacts us. Yes, we're emotional. We cry. We're upset. We're introspective about it, and it subsides, right? However, sometimes the trauma transcribes into a disorder, as we noted by the DSM, that it's prolonged. If you begin to see after 6 months or more that you're getting these triggers, that your body is not recovering, then we begin to take a look at it a little bit further. Acute trauma, a singular event, or chronic trauma, again, secondary. Trauma can be so complex, especially when it happens at a very young age in childhood with repeated abuse, repeated war or conflicts, and it impacts our daily life. Symptoms of trauma that occur can be emotional in terms of, right, I mentioned crying, anger, sadness, physical, headaches, stomach aches, being lethargic. Of course, it can impact your sleep. If you're having lethargy, you could sleep even more, or you just can't sleep at all because of fear of having nightmares. Behavioral changes, maybe self-destructive coping with substance. Professionally, you might lack motivation. Your job performance might change. Responsibilities seem overwhelming. Cognitively, have difficulty concentrating or making decisions, right? Or reliving the imagery of that trauma. Spiritually, you could be questioning the meaning of life and lacking self-satisfaction. And oftentimes that can lead to suicidal ideation, and in fact, suicide. Interpersonal relationships, withdrawing from coworkers, friends, loved ones. If you see any of these changes that are prolonged, it involves a conversation with someone, right? We often see a stigma with sharing with someone. It's interesting with the stigma, I just want to insert here briefly, is that mental health is not something that is seen. It's not like you broke your arm or you cut yourself and you're bleeding and people can see it, they can visualize it, and yes, you're hurt, you're impacted. But with mental health, that's not something people see readily. What they see are the physical or behavioral manifestations and wondering, well, this person is anxious, or this person is irritable, or this person has just pushed me away, or they're not doing well at their job, right? So then what happens is they're focused on the symptom and not the root cause, right? So I think we're really making strides globally to begin to start having conversations about mental health and what is occurring, especially with trauma, right? I had a discussion, I think, last seminar about, or the last seminar with Ghana regarding the United States. It seems like we're inundated with mental health providers, coaches, life coaches, therapists, counselors, psychiatrists, etc. And yet the numbers in the United States of loneliness, isolation, despair, sleeplessness, polypharmacy, taking 10 or more drugs, psychotropics, cannabis use, alcohol use is increasing. And yet we have these mental health providers. So there's something going on. And we're going to talk about that a little bit further, but keep that in your mind. So some
So Andrea, sorry
yes.
again. I
Yes.
don't only one. I'm unable to see your slides.
Oh, okay.
Yeah.
I'm not sure why. Can other people?
Yes, your slides are showing now.
They're showing now?
Right now, yes.
Okay. I think it might be your internet, but let me know. Can you see this?
Yes, it's showing now.
Okay. Okay. Let me do this. Let me turn off my video. Maybe that will help with the bandwidth. I don't know if
Right. It's clear now. I can see it now.
it's clear now. Okay, perfect. All right. So some physiological impacts with pain, as I mentioned. Your circadian rhythm, right? That's your REM sleep. It's interrupted by pain. The reason I bring up pain, let me just say laterally, the reason I bring up pain is because oftentimes adults diagnosed with PTSD have a higher level of pain reported. And it to me, it makes sense because you're carrying it in your body and you're at a constant chronic tension or hypervigilance of your sympathetic nervous system, which we're going to talk about. And there's a feeling of isolation. Interesting, even though I mentioned that there's, more than 320 million or more adults with diagnosed PTSD, it still feels isolating when we're experiencing something, right? I think that's what is so wonderful about having a mental health provider or someone that you can talk um, uh, to express yourself and understand the impacts. To me, uh, the first step towards healing is to recognize something is going on, something is causing these symptoms, and possibly it's chronic levels of trauma experienced. Another element of trauma is due to death, for grieving and loss. Trauma in terms of grief can lead also to PTSD. When after, as I mentioned, after 6 months, after a year, you're still experiencing this grief that is stymieing, that is preventing you from living a healthy well-being in your life, in all areas of your life, and finding that balance. I don't want to go through these at detail, but definitely read these when you're looking at the slides. We all, I think, have acknowledged the basics of grief and loss: initial shock, denial, anger, bargaining, depression, acceptance. And these are, these can be random, not necessarily in this order. I think, but at the end of it, I think is the acceptance of, okay, I need to take the next step and move forward. And you find a form of healing, and integration back into your world, right? Grief and loss continued, can morph into PTSD, and it's very serious. Some traumatic determinants, as I mentioned today, not only vicarious events, but I can't stress enough how social events with social media and the internet are causing prolonged traumatic symptoms and causing more and more people, to have these prolonged stressful adaptations physiologically. So, so what's happening today? You know, um, and again, when I'm speaking with PTSD, we're looking at prolonged, right? It's just not subsiding. With anger, irritability, body aches, alcohol, all the things I mentioned. Some people begin self-sabotage by cutting or self-infliction, lack of concentration or chronic tension, jumpiness. Oftentimes people feel klutzy or like they fall, their equilibrium is off. The self-talk is huge. The way we talk to ourselves with blame or guilt or negative talk, putting ourselves down. PTSD can also cause a form of hallucination or repeated thoughts of the event occurring. And of course, they can sabotage our life and our balance. We're going to look a little bit at trauma and the neuro impacts. Since neuropsychology is my area, I felt it remiss if I didn't talk about this. PTSD and prolonged trauma really does begin to affect our neurofunctioning. In layman's terms, it affects our brain, right? And our cognitive processes and our thinking. Trauma, as it occurs, and PTSD prolonged, affects our prefrontal area, and we begin to lack decision making, or our thoughts are fragmented. We have inappropriate responses, where something's sad and we're not affected, or we laugh at events that are not worthy of laughing. The hypothalamus is a part of the brain that is impacted by prolonged stress, anxiety, imbalance. When we have PTSD, cortisol levels just intuitively increase, right? Norepinephrine and hormones increase. They impact our balance, and they keep us from going into the parasympathetic system. The amygdala, I mentioned earlier, the fight, flight, or freeze, and that's the part of the brain is the amygdala, that controls all this. So with chronic PTSD, our neurofunctioning doesn't get a break, right? There's no calm. There's no just allowing our brain to relax. And yes, it can do permanent brain damage. So we really want to address PTSD. We really want to understand it, get the support we need, and make changes so that we can have a life that is full of well-being. When we see trauma, or we have prolonged PTSD, right? We're focusing on the sympathetic nervous system. The sympathetic nervous system is is wonderful. It keeps us moving, right? Um, it gives us action and movement, right? The sympathetic nervous system, as you can see, um, controls so many parts of our body and our organs, right? And these are all needed for functioning. With PTSD, we can never thoroughly move into our parasympathetic nervous system, which allows us to have a slower heart rate, allows us to calm. It allows our organs to to recuperate, to regenerate, right? It allows our digestive tract to relax and our intestinal tract to function properly. Our blood vessels can relax. Going into the parasympathetic system typically happens when we sleep. It can happen when we have slower breathing, which we're going to talk about. Um, it can happen when we meditate, when we laugh, when we're in joy, and we need the balance, right? Our bodies are these amazing, full functioning systems, and we need the balance of the sympathetic and para. So with PTSD, we hardly get to the parasympathetic, and our we just there's no way around it, but our brains and our bodies get exhausted. And then what happens? We start seeing the irritability, we start seeing the digestive issues, et cetera, et cetera. So part of how we can move into the nervous system, we're going to talk a little bit about. There are some things that we can take, especially when I've seen patients with PTSD. Of course, most of my patients have a form of dementia, and so I really focus on helping calm, uh, looking at antioxidants, um, eating foods that are not full of preservatives, additives, coloring, sugars, etc. Basically, anything in a box or a bag depletes um, depletes our nutrients, right? We want to keep cellular health well. We want to keep that oxidization going. Vitamin Bs, a deficit of vitamin Bs can cause nerve impact, affecting our communication. All of these occur with PTSD, right? It impacts, we get oxidative stress, right? If we're constricted all the time, we have oxidative stress. We could have uh, a deficiency in B. It's a time when it's really important to eat healthy proteins, minerals, vitamins, for just healthy brain functioning, right? Neurotransmission. Um, a lack of omega-3s causes memory and cognition. With PTSD, as I mentioned, right, when we looked at the prefrontal, um, we could begin to start having vision and sleep and memory and cognition impacts. So to get we want to get our nutrients balanced. Um, with PTSD, if there can be a higher dosage of all of these in terms of a treatment or management, it can help balance and calm things. Um, mental health, PTSD is a diagnosable mental health disorder. Um, it's funny because we don't always think of it in terms of a mental health. We just focus more on the trauma, but it really is a mental health. As I mentioned, it has neuro impacts, physiological impacts. It messes with the way we see the world, with the way we see ourselves, right? And it can exaggerate physiological symptoms that might not even be there. It can exaggerate pain um, that has no root cause, right? Um, there can be determinants of hallucinations, and as I mentioned, can even lead to prolonged depression on top of PTSD, and also suicidal ideation and suicide. Some effective therapies for PTSD have been psychosocial therapies, um, focusing on the mental health and looking at the trauma itself and trying to minimize that. Cognitive behavioral is looking at changing your behavior in terms of remembering the trauma itself. Some alternatives of EMDR, eye movement desensitization and reprocessing, and EFT. I happen to use both of these quite a bit for patients that are experiencing PTSD, and I do a modified for adults with dementia, where it minimizes the emotional response. It minimizes the connection to that trauma. So eventually you can think of that trauma and you're not going to have, it's not going to have a deep impact. I highly recommend that. Exposure therapy is pretty delicate, and not all therapists do this. This is actually like reenacting just mentally the trauma. I think it's kind of tricky because you really want to have trust in your therapist, and I personally don't always believe that commiserating or reliving the therapy is the approach. However, everyone is unique and everyone has a unique way of healing. So, it's the therapist can help guide you onto what treatment is best. And of course, there's group therapy or couples therapy or family therapy. And lastly, there's prescriptive management. The other thing I want to talk about is retraining your self-talk, right? Sometimes I think the way we talk to ourselves, we would never in a million years talk to someone else that way. We would never talk to our loved ones the way we talk to ourselves. And so really having, really changing the way we approach ourselves is a begin. Some psychopharmaceutical considerations. You have to review this with your physician and your mental health provider. The issue with PTSD and other mental health disorders is that it really begins to impact the way we process prescription drugs, psychopharmaceuticals, and the way we metabolize. Antidepressants can actually worsen our symptoms instead of making it better. I'm not, I'm a strong believer in alternative measures, but sometimes we need that pharmacological short term to just alleviate the stress for a moment and just get us calmed down. The thing about, I mentioned the amygdala, the fight, flight, or freeze earlier. And the thing about it is we want to get into that parasympathetic, um, and we want to calm our body enough in whatever way it works, whether it's pharmaceuticals or therapy, walking on the beach, singing, whatever it is. We want to get that calm, because in that calm, we begin to have a clarity and things start looking very different. It's almost like going from black and white to full vivid color, and you didn't even realize that was an option. Mental health, which PTSD is a mental health disorder, it's very personal, it's subjective, right? I mentioned we don't see it. We see the symptoms, but we don't always see it. So oftentimes, and this is part of the stigma, um, not everybody is on board with our trauma. Not everybody is in concurrence that it's impacting you as deeply and profoundly as you're saying. This is the stigma when it is impacting you this way. Um, and that's why I think it's so important to begin to explore this, begin to talk to professionals, and begin to find that internal well-being, right? We want to feel alignment with what we think, what we say, and what we do. That's the ultimate, right? We want to be in line with our values and feel contentment and peace and that positivity and optimism about life. Um, take a look at this at your leisure later, but mental health on a continuum, healthy. The healthy extreme is calm, steady, physiologically normative functioning. You're rested, you sleep, you're eating well, you're in control of your self-talk, you're in control of taking care of your body, you're socially active, you can laugh and have a sense of humor, you can relax and play, right? The opposite end of the spectrum, uh, often with PTSD, as I mentioned, is exhaustion, fatigue, sadness, self-talk. Symptoms are just getting worse and worse, right? And yes, it can lead to physical manifestation of pain and aches, and um, on and on. It can lead to falls, injury, etc. So we're human. Our continuum is fluid, right? But when you start seeing the orange of injured or ill, the red, we want to begin to start taking a look, you know. And to me, this is so wonderful because you can just say to yourself, where are you today? Like, where am I today? Oh, I noticed today I'm easily agitated by everything. Hmm. Yeah, I've been a little bit tired and I can't seem to concentrate. Like, where does that fall on the spectrum? And then how do I recalibrate and get back to the healthy, right? Um, Begin to have patience with yourself. The thing about mental health is, even though we can have a mental health provider support us and guide us into managing PTSD, it's a very internal and isolated, isolated process, and we have to have patience with ourselves. We have to give ourselves a break and have compassion, right? We have to understand we just came through this great conflict, or this repeated childhood of trauma, or we just experienced death, or something so traumatic. And one of the questions I'm asked, and perhaps you're thinking, is, can a person be cured of PTSD? There is much debate of PTSD, and yes, I believe that a person can be healed of PTSD. One, if they want to, and oftentimes it can wane over time. It can be managed. Sometimes the PTSD is so manifested that there's often secondary mental health disorder, where I mentioned how we have dissociative affect, where it could go into secondary mental health disorders, which make it very challenging, right? Because then you're dealing with symptoms and you can't find the homeostasis of what caused what. But I truly believe that prolonged trauma, stress, PTSD can be managed, and you can heal from it, and you can minimize it. Other researchers, it's in debate, but I think the human spirit is quite strong and has the capability to heal from events that we didn't think one could heal. Begin to, I know we're kind of wrapping up, begin to look at that continuum, that chart, and be honest with yourself of where you are today on that PTSD scale, or on that well-being scale, and be truthful and start being aware of your needs. Since mental health is an internal thing, we have to come at it internally. We have to begin to be aware of, oh, what's happening with us physically? Like, am I stressed? Is my body relaxed? Focus on the immediate here and now. Sometimes, I don't know if you've heard this term, to be grounded. Whenever I meet with patients, I always ground myself first, before, and I ground myself afterward, so that I'm not experiencing vicarious trauma. And one way to ground yourself and to be in the moment is to, put your hands or your feet or your body on something that is solid, that won't move. Lie down on the floor, on the earth, and feel present. Like, put your hands on something that's cold. It'll bring you right into the here and now. Be aware of your physical, emotional needs. Completely understand any kind of drug-on-drug interactions or medical issues. Look at where you are with your diet, with your prescriptions, mentally, physically, and what is out there. What can you do with agitation? As I mentioned, find a calm environment, lie down on something that's solid, remove any stressors, if that's plausible, limit caffeine, sugar, find soothing options, look at alternative therapies, avoid environmental triggers, lightning, noise, background distractions like the landscaper outside. My apologies. Monitor loved ones' personal comfort. I say this, I put this in here because oftentimes we have vicarious trauma from someone else. If we're a caregiver for more than a year, we can begin to have chronic levels of all that I mentioned, the physiological, mental health, the neurostimulation, etc. And we need to begin to look at what are our needs. Simplify our daily routines, exercise, stretch, feel what it is to be in your body. Also, we want to communicate. I talked about positive self-talk. Sometimes when we're in pain or when we're going through a trauma, or probably most of the time, our self-talk is impacted. We want to get back to looking in the mirror and giving redirection to our self-talk. We want to minimize environmental impacts. We want to redirect. I mentioned earlier that I'm not fond of commiserating. That means, you know, if you're upset about something, you want to hang out with someone that is also upset. So you both can be upset together. And then what happens? You continue that upsettedness. Sympathetic, not moving into the parasympathetic. Commiseration keeps you in the sympathetic. We don't want that all the time. So redirect your attention to something that brings you laughter and joy, right? And sometimes just being with people that love you. Focus on stories or memories that are enjoyable. Look at movies, music, art, nature. Again, we want to redirect our attention away. You can, if you are able to practice meditation, but again, you don't have to close your eyes and meditate. You can be in the moment by laughing. When a person is laughing, they are 100% in the moment, because it's very hard to laugh and be thinking of something horrible, right? Again, redirect. Make a list of 5 activities that you can easily engage in, that you write down somewhere. You don't have to think about it. You wrote them down. When you're feeling stressed or you see that continuum is getting in the orange or the red, look at your list and engage in one of those. Take a walk, breathe, walk away, stretch, move. I put this in here, and I know we're running out of time, but I want to encourage you to take a look at this and really learn how to breathe. Most people's breathing is shallow. And when you're experiencing PTSD, your breathing is even more shallow. So we wanted, whatever breath you take in, like let's say you count in to 10, breathe out 10. There's another technique, the 4-7-8. You breathe in through your nose for 4 seconds. You hold your breath for a count of 7. You exhale for 8 seconds. It seems long. Do whatever's comfortable for you. This is just a guideline, but you want to get that carbon dioxide out, right? You want to breathe in. You want to release it all out, and you want to release it even further than what you're breathing in. So you want to learn how to calm. 20-30 minutes of calmed breathing can lower your blood pressure. And then what happens? You're moving into the parasympathetic. You're neurofunctioning. Your brain is going, oh, thank you, I get a break. your body is relaxing and you have this balance and equilibrium. Just to wrap up, begin to notice, journal, write things down, focus on the positive for your mind. For your body, take a look at your sleep, your energy, your eating, your nutrition, and find a balance. You don't have to go out and make quick changes, but just begin and begin to support yourself and value you and do activities like your faith or exercise, laughter, etc. And I want to say this because it's not always easy to do when people have trauma or PTSD. But look in the mirror, and if you can, begin to say, you are worthy. And in fact, don't even say you, say I. Look in the mirror and begin to say, I am loved, I am lovable, I am valued and special, I am enough. And I know these might seem a little silly in a way, but trust me, they're not always easy to do. But begin to have that conversation with yourself and have a healthy self-love and respect for yourself, and kindness for yourself. Connect with those people that love you and support you, that are inspiring, that are uplifting, that encourage you and empower you, right? I want to thank you, and I'm so sorry we went over a little bit.
All right, so thank you so much, Dr. Holzner, for that very insightful presentation, as always. I loved the very actionable steps you shared, very pragmatic steps you shared on navigating trauma. I particularly appreciated the part where you spoke about self-care and how we should be mindful about how we talk to ourselves, our self-talk. And that in particular stood out for me. So thank you once again. So ladies and gentlemen, at this juncture, we would proceed to the question and answer session. And as a quick reminder to our audience, if you have any questions, you can feel free to drop your question in the chat box, or you can raise your hand virtually and you'll be given the opportunity to ask your question. Doc, you spoke about normal fluctuations in mood, and I want to find out what characterizes, or let me rephrase this. Mood swings are normal. That's what I got from your presentation. Mood swings are normal for every healthy human being. So at what point are mood swings not normal? I don't know if I've phrased my question well.
No, I think I understand. In the chart that I mentioned, that I showed, where it showed the continuum, right, with the green, the yellow column, the orange, and the red. It's very healthy, right? We see something, we get upset, well, we recover, right? Or we're happy. And we're human, we have these different emotions. But when you start seeing that your emotions are in the orange or the red repeatedly, chronically, that's where you really want to, have an honest talk with yourself about, oh, what's happening? Like, I want to be in the green, right? I want to go. Interesting, just with traffic lights, like green is go, red is stop. The more that you're impacted, the more you can't move. You physically can't move. You can't find momentum and balance and progression in your life. Whereas when you're in balance in the green column and well-being, it's just clarity, and you have cognitive clarity, and you're excited about life, and there's movement. So I think to me, that chart is such a healthy, quick way to observe where we are and take stock on that.
Okay, thank you.
Thank you for that question.
All right, so I see Dr. Evelyn Roberts' hands are up. Doc, you have the floor.
Hi.
Okay.
Thank you. Yes. So thank you very much for the presentation, Dr. Holzner. That was very enlightening. I think that for me, one of the things I'm really very interested in as well is EMDR and EFT as techniques for addressing PTSD. Could you speak a little bit more about that? I think just out of my own personal curiosity, because I want to know a little bit more about how you do that in your work. Thank you.
Yeah, thank you. It's nice to meet you, Dr. Roberts.
Well,
yeah, so EMDR and EFT, as with any type of therapy, involves a certification. So there's a training. I think some are 1 year. So, it varies, but there are trainings out there, and then you take the training, you get your certificate, and then before you're on your own, you apprentice or intern with anywhere from 1,500 to 3,000 hours. So it's quite a process. What I love about EMDR and tapping, and I do sort of a modified form, is that it, in a quick way, and I'd love to have this conversation offline a little more, Dr. Roberts, but in a quick way, what it does is it sort of it disengages the emotion from the event that's stored, and it just you have your mind and your body doing something that is not in alignment with what you have been doing. So, for example, I had someone help me with EMDR when my mother passed and I was grieving, and it was so impactful. After more than 6 months, I just wasn't moving on with my life, and I didn't want to. It was quite intense, and I had someone help me with EMDR, and what it did is, after doing the exercises for about 30 minutes, and this is how powerful they are when done correctly, I still grieved, but it wasn't controlling me, right? Like, it minimized, like it sort of is this way of just calming your emotions. And you still think about the trauma, but it's not overwhelming. And what it kind of does is it confuses your neurotransmitters that have been conditioned by this trauma. And but yeah, I would love to chat with you about it further. It's super, it's
powerful. Huh?
It's powerful. It's alternative, okay? It is alternative. However, I have used a modified version that I learned from Dr. Taki Amano in Japan, and he did modified with adults with dementia who with dementia and Alzheimer's, you have chronic cell loss, brain cell loss, right? And neurotransmission that is impacted permanently. And when I do modified EMDR with patients, it calms their behavior and they're not, their behavior doesn't fluctuate again like that. And this is without prescriptive treatments.
Wow.
So to me, I want to do anything that minimizes, taking something. Our bodies, our brains, our bodies are so powerful, and it's so beautiful that we have the ability to heal ourselves in many instances.
Yeah. Definitely. Thank you so much. I look forward to speaking more with you about this.
Oh, I'd love to.
Thank you.
All right, thank you very much. That was Dr. Evelyn Owusu Roberts. She's a clinical psychologist and faculty member at Regent University College, and the respondent for tonight's webinar. All right, so we're proceeding with a question and answer session. I have seen that Erasmus' hand is up. Erasmus, you have the floor, please.
Thank you very much, Mr. Ben, Mr. Labi, and Dr. Andre. Okay, thank you very much. Please, first of all, I want to know the full meaning of the EMDR and the EFT. And also, before this webinar, I was trying to I was reading about the PTSD. I watched some videos on YouTube, and then the speaker said something. She said modern psychologists are redefining the philosophy behind PTSD from it being a disorder to a reorder, as in post-traumatic stress reordering. I don't know if you get what I'm trying to say, but she said it's not supposed, it's more like the cognitive processes are reordering to the traumatic event that happened to you. So we don't have to term it a disorder.
And what is your question?
Hey. I wanted to understand what you also think about the fact that modern psychologists are redefining the philosophy behind PTSD as a disorder, as a reorder instead of a disorder.
Oh, yeah, thank you so much. Yeah, and that's what I was saying earlier, is that I think PTSD, that people can be healed from PTSD depending on how the complexity of it and how it's manifested, right? Because it can cause secondary symptoms. And then you're dealing with multimorbidity, which is harder to heal and manage. So I do believe strongly that there can be a reorder, there can be healing. However, I'm going to say it depends on the trauma, and the person themselves. I mean, it's so complex. I think the term for me, instead of reorder, is management. I think there's a way. Yeah, I think there's a way to to minimize the emotional response, to minimize the physiological impact, and to calm, and find a sense of well-being, right? I think it just depends on the trauma. And the thing about emotional response or triggers is that we never know when it will occur, right? And so I think the answer is yes. I think there can be management or reorder. I think it's just complex. I don't think we can generalize you know, it's just so diverse, you know. But I do think that it's hopeful, right? It's hopeful to say reorder than disorder,
Okay, ma'am. Thank
right?
you, doctor.
Yeah, I will just add that, and you bring up a great point, because is it so important? And we don't. This can be rhetorical, but is it so important to um, to label? Do we need to label ourselves? Right? We
Mm.
could have depressive symptoms and go into the doctor and say, yeah, I've been feeling depressed, and they give you some kind of psychopharmaceutical. But does that mean we're clinically depressed? Even if we've have been feeling depressive for 6 months? Or is there something at the root that we're not really talking about, right? So I don't, this is a longer conversation, and one that I would love to dialogue, but is it so important for us to label ourselves? And I've never liked labels. I don't. I've never been a advocate of labeling myself.
Thank you very much. But please, I also want to know the full meaning of EMDR and EFT.
Did you say the formula?
The meaning of EMDR.
Oh, it's eye movement desensitization and reprocessing. And it's a whole conversation. Like, I could teach a whole course on it. I will send Benjamin some information on it, that he could share with all of you on it, so you could take a little further look on it. But again, it's tricking your body, your mind, your body, everything, into not having the normative response.
Okay.
And but yeah, I think it's a wonderful alternative, and I highly recommend it.
Okay.
Thank you, doctor.
There are a couple of questions in the chat. There's a question from Jane Saki. She's asking, how do you control triggers? Actually, there are about 3 questions from Jane Saki. How do you control triggers? That's one question. And number 2, how does one tell if they have PTSD? How do you control triggers, and how does one tell if they have PTSD?
Well, as yeah, thank you for those questions. So as I mentioned earlier in the presentation, if you begin to have symptoms from a trauma or event that are lasting 6 months or longer, or years, and they're impacting your life, right? Like, they're impacting your energy, your zest, your, you know, your interpersonal relationships, your career, your well-being, then I would definitely go to a mental health provider, and talk to them and see if this is, if you are experiencing PTSD. Now, as I mentioned earlier, it's normative to see a trauma and experience a reaction, right? We're human beings. That's what happens. Even the animal kingdom, lions, another predator falls in front of them, and they're like freak out, and then they go into battle, right? It's just part of nature. So, but where you really learn to see the PTSD development or evolvement is that these symptoms are impacting your life and they're debilitating. And if you look at the continuum that I mentioned, that I showed, I think that's a great chart to really have self-evaluation and an honest talk. How do you control triggers? Well, that's a great question. We were just talking about EMDR and EFT, and different forms of therapy can help you. Cognitive behavioral therapy can help preemptively realize, oh, I just got triggered, right? For example, let's say someone was abused as a child or something, and as an adult, whenever someone comes up behind them or something, they might instantly get triggered, right? It sparks a memory. A trigger is a memory of that traumatic event. And it could be anything. It could be a touch, it could be a scent, it could be a noise or something. And there are ways of minimizing or managing those by different types of therapy, by realizing, oh, this was a trigger. Okay, here's, I mentioned a list of 5 activities that bring you into calm, into the parasympathetic. Well, you have to redirect, right? You can't lean into a trigger, because if you lean into it, you won't get out of it. You have to redirect and get into the calm. When you're in a trigger, when you're experiencing symptoms due to trauma, it's not the time to make decisions, find clarity, or have clarity or anything. We want to get into a calm. And that's once we're in a calm with therapy, EMDR, whatever it is, then we can begin to talk to ourselves. We can begin to manage the triggers and say, okay, the next time this happens, I know it's going to happen, and here's 5 things or 4 things that I have the option of doing to get me out of it right away, right? Exposure therapy, I mentioned earlier, is not my favorite form of therapy because you expose yourself to this trauma. However, on the other hand, when you bring something into the light, it's not as scary, right? So I think that's kind of how we manage. It's not, the answer to your question is just not so easy. It's complex. It's the labyrinth of what I've listed in this presentation today.
Okay, so there are a couple more questions. There's a question from Abigail Abamu. She's asking if children react differently from adults while experiencing PTSD. Do children react differently from adults when experiencing PTSD? And there's another that also on children's reactions to PTSD. That's from Jane. She's asking how to identify if a child has PTSD of losing a mother they have never been able to grieve as young as 10 years, and how do you help them manage this?
Yeah, the answers to that are fairly complex. I will say this in brevity, that children are so resilient, it seems, in the moment as children. They things are not, the world around them is not so set, like in concrete as we age, right? They're malleable, they're growing, they don't hold on to things, right? Everything's growing, their brains. But interestingly enough, in studies, children that have experienced trauma, while they were a child, they might have not expressed it, in the way we think they should. But as adults, it comes out. It comes out even later years, and in terms of triggers and such, and their self-talk and different areas in their life. So it's quite complex. A child that has experienced loss in different forms, that will definitely impact how that child navigates life, but it also is dependent on who is the support structure, right? It really takes a village and community for all of us to heal. We're not an island onto ourselves. Like, it really takes support and encouragement. And if a child lost a mother at a young age and wasn't very expressive, but had wonderful family and friends around them that helped them develop a sense of confidence and safety and navigating the world, that's one story. You have a child that lost its mother, and then it ends up in foster care and doesn't have the support and stability and such. That could be a whole different story. So it's just so complex, and I think we have to look autonomously at that person to really fully understand how to help them heal, right? I hope that was helpful. It's complex. It's not so straightforward. And child psychology is not particularly my forte. I specialize in the other end. I specialize in the aging and geriatric community, but I have read in studies that children experiencing trauma, it often manifests as adults because it wasn't managed at the time. Thank you for those.
All right. Thank you very much, Doc. Okay, so do you have any key takeaways you'd want to leave with the audience? Would want to wrap up from this point?
Well, I think the ultimate goal of trauma, like, trauma is just, we can't escape it, right? We're just going to experience all of life's complexities. And I will say, as we're younger, we don't always have the option to choose our family or our friends or our situations. As we get older, we have a better chance of making choices that are for our health and well-being, right? I think it's important for us to maintain a healthy self-respect. At the end, I mentioned looking in the mirror and saying these affirmations to yourself. I encourage you, and I guess in a way I challenge you to do that for yourself, to look in the mirror and wholeheartedly say, that I am loved. I am valued, and all of those things. And if you find that challenging to say, I would begin to have a conversation with yourself and maybe a mental health provider. Minimizing the stigma of mental health, the first part of it is education and awareness, right? We just need to understand the complexities. And as if you were here in the last seminar, you know, I really like just getting back to basics. I think that's what's so needed today. And the basics of what Plato talked about. You know, I forget exactly. I think, don't quote me, but I think he was like 200 or 100 BC. I can't remember. But Plato talked about finding a balance. And now here we are in 2024, still talking about the same thing, right? Balance of sleep and work and community and eating well and laughter and play and learning. We have the blue zones that are so popular now. Excuse me, a study that talks about finding balance and just getting back to basics, you know, being close to someone, laughing, disconnecting, you know, getting off of social media and the internet and connecting with the earth and appreciating. I think every day we have a choice. Sometimes we feel like we don't, but we do. We have a choice to wake up and say, wow, what a wonderful day. And I know this is funny, but sometimes I wake up and I go, yay, I woke up. I get another day. You know, because we just never know. But to have that excitement for life, even when we have challenges, you know, I really encourage all of you to find that equilibrium.
Okay, so thank you so much once again, Dr. Holzner, for the very insightful presentation. Very extensive, yet very concise. We thank you for your time and for sharing all your insights and your expertise from, you know, decades of experience in the field. So we appreciate you for everything you've shared with us tonight. And at this juncture, I would hand over to Dr. Owusu Roberts to briefly share some remarks.
Thank you very much, Mr. Labi. Thank you once again, Dr. Holzner. This has been a really insightful couple of, I think, an hour and a half. One of the things that I found to be really important was the neuro impact and how, you know, really having that understanding that mental health issues have that, you know, brain level impact. And I think sometimes because of the symptoms, which are very behavioral, and we can forget that this actually has roots, you know, neurologically. So being able to highlight the actual brain level impact is really important, and also further highlights the importance of seeking expert help, you know, when it comes to mental health issues, especially when we are looking at problems like PTSD. Also, knowing that mental health issues like PTSD have that neuro impact or that brain level impact, it's also important because then we can be a little bit more empathetic, like Dr. Holzner also talked about, so that especially when it comes to the expectation that we have for people to quote unquote get over very quickly, we can be a little bit more compassionate, knowing that you know, what's going on is deeper than just seeing someone outwardly respond to sorry, excuse me, to the trauma that they have experienced. It's also further important to also remember the importance of cellular health. When we're looking at a mental health issue like PTSD, one of the symptoms can be issues with, eating, the lack of appetite that you may have. However, being able to be mindful about how you're eating and the nutrients that we need is so important, because we are really actually helping ourselves, in terms of addressing the symptom, but then we are also powering our bodies to help fight, the PTSD condition itself. So that cellular health, nutrition, is really important. Sometimes when people are depressed or going through some sort of trauma, the reaction is to also emotionally eat, right? And sometimes what we eat may not necessarily be healthy. It might be chocolate, it might be ice cream, and where, sometimes gaining that pleasure, a little ice cream won't hurt, but then to have that be how one copes with like a mental health condition like PTSD is necessarily not helpful. So I'm really glad that Dr. Holzner highlighted that too as well. In addition, she talked about, the psychopharmacological consideration. And sometimes, even as a clinician, these are questions that I get asked. Do I need medication for what I have, this mental health issue that I have? And sometimes what I say is, therapy has no side effect, right? It doesn't impact your body the way a medication can impact your body. However, there is, you can't really throw the baby out with the bath water, in the sense that psychopharmacological help sometimes are needed. And especially when someone is experiencing a mental health condition in such a really severe and profound way that they can't benefit, they can't do therapy, they can't sit in therapy, they can't implement strategies, they are not there. You really do need that psychopharmacological help, so that you can get to the place also where you can actually also do therapy. So sometimes it's really important to take medication. And so I'm really glad that Dr. Holzner highlighted that too as well. The mind-body connection is important. Like she has also talked about, sometimes, again, we can it can be a little bit surprising that you can have a mental health issue, and that the mental health issue you have literally affects your body physically, that it can cause hair loss, it can cause digestive problems, that it can cause muscle ache. And sometimes this is not common knowledge. And so for this to be highlighted is really important, because sometimes, again, what we find is that these mental health issues are manifesting physically, and also some of these physical health issues are part of the symptoms of a mental health issue. So knowing that is important, so that when you're going to the medical doctor and you're running all the tests and it's like there's nothing wrong with you, while it is good to have a medical doctor who is psychologically aware, it will be good that we ourselves are aware, so that we may consider, have you thought about maybe seeing a mental health therapist, for whatever it is that you are dealing with. So I think that is also something that is really important. Now, I also want to talk about the practicality of the Dr. Holzner's presentation to us. So she's also given us things that we can practically look on, like the mental health continuum, being able to assess where you are, so that you know You can always have that personal assessment to know, okay, I'm doing well, or maybe I need to put in some of the interventions that she's suggested, some of the coping mechanisms that will get me to the place that I need to be. When Dr. Holzner was really talking about some of the confessions, I was thinking about our setting and how sometimes spirituality is something that we can't take away from either our understanding of some of these mental health issues, or even looking at it in terms of intervention. So for those of you who may be Christian, for example, and who may struggle with saying certain things, like some of the positive self-talk, phrases, you can almost think about that as what we call in our culture declarations, being able to declare, or confess, certain positive things about yourself, and then that can really help when it comes to mental health treatment. But yes, when it comes to diagnosis in our neck of the woods, we do know that there are some complications. Sometimes you may have PTSD, but it can even be difficult to get that diagnosis for a lot of different reasons. One is, access to mental health care. There are some people who don't know where to go to when it comes to assessing their mental health care services here in the country. We also know about the stigma that tends to happen. And then there's also the socioeconomic, factor. Sometimes even getting access to medical care can seem like a sacrifice. Sometimes people need to see a medical doctor, and it's something that can be difficult because depending on the hospital you go to, it may mean long lines. It may mean going back and forth from this department to another. And it can really be a sacrifice just getting access to a medical doctor, not to talk about, the cost involved. And so in our neck of the woods, again, we know that sometimes mental health services seem like a luxury, that you would actually go and sit across a therapist, or actually seek a therapist online to say, this is what I'm struggling with. And sometimes it can be a little bit of an issue. Then we also have the spiritualization of some of these mental health issues. Here we call them spiritual attacks. So looking at some of the PTSD symptoms, it's easy for someone to say, oh my goodness, you're experiencing a demonic attack. It's a spiritual attack, And so then when you also have, a pastor who is not mentally aware, who is not very conscious about mental health issues, then it becomes, oh, let's just pray, bind, let's just, cast it out. While that's, because of the spiritual environment we find ourselves in, while that is not something that clinical psychologists are to fight against, it's also important to widen, the usage of the tools in your toolbox. It's what I like to say. So as you are addressing, your mental health issues spiritually, it's also important to address them, with by the use of mental health experts, especially if it is a mental health, issue. Another thing I like to say about mental health issues is that sometimes when we are looking at some of the symptoms that people with mental health issues have, we really are not able to see the mental health issue. We tend to see the consequence of, or the symptoms of the mental health. What I mean is that sometimes, so let's take PTSD, because that's what we are talking about. Someone is going through, the symptoms of PTSD. They have concentration problems. They may start to cope using substances. They have irritability, angry outbursts. So as the outsider, you are not seeing a mental health issue at play. What you're seeing is, oh, this worker of mine is really starting to fall off, or this student of mine is really starting to fall off. And it's really important that we have more than one lens when we are looking at the behaviors of some of the people around us, so that we may dig deeper. Dr. Andrea talked about really looking at some of the root causes. So yes, we are seeing someone be really annoying to be with, someone who seems lazy. But is it them being annoying? Is it that they are being lazy? Is it that they are now, just starting to use, substances, or is there something deeper going on? And when we put on this different lens, it helps us to be more compassionate, and it really helps us to be able to engage with some of these people so that we can really know what might be going on. And then if we need to refer them to the appropriate mental health experts, we do that even as we ourselves support such people. So, this has been a really, it's been really informative this evening, and I'm really glad that this was put together. Thank you very much, Mr. Labi, for putting this together, and thank you very much, Dr. Holzner, for honoring this invitation once again. Thank you so much.
Thank you.
Thank you very much, Dr. Roberts. That was very insightful remarks. And I appreciate your additional perspectives that you shared from a clinical psychological background. Thank you so much. So, ladies and gentlemen, on this note, we draw the curtains to today's session of the Mind and Heart series. And we would like to thank, of course, our speaker, Dr. Holzner, renowned neuropsychologist and gerontologist, for connecting with us and for sharing these actionable insights on trauma and PTSD. I believe the session has been very impactful, and we've all been armed with tools and insights to navigate trauma and PTSD. And I hope we've all found today's session informative and transformative. So for details about our subsequent webinars and events, you can follow Regent University College of Science and Technology on Facebook. That's facebook.com/Regent Ghana, or Regent Gram on Instagram. All right, so I would like to, of course, thank our respondent as well, Dr. Evelyn Owusu Roberts, the remarks that she shared. I'd also quickly thank the head of the Department of Psychology at Regent, Dr. Martin Akapo, for the phenomenal support, technical support that helped make this webinar series possible. And lastly, I would like to thank the technical team lead, Mr. Enoch Damche, who's helped us with the recording of this session, which will be available on YouTube. Thank you once again for connecting to this session and for making this session engaging and interactive. My name is Ben Labi. I'm the head of communications at Regent, and it's been a pleasure moderating tonight's session. So until next time, I look forward to connecting to you again. Bye.
Bye.